The other day we were talking and I was sharing with you an experience that I had in a hospital. I'd been in hospital for a kidney stone. And I shared with you some of the touch points that I had in that hospital setting.
Hmm.
And I got the sense that the hospital wasn't built for me, that it was um, built for a procedure. Like it was built for a very functional purpose.
Hmm.
And there were many instances in that experience where I could feel a certain level of friction,
Hmm.
the friction of being under very intense and bright light all the time, whether someone was interfacing with me or not. So whether I was in a state of active interaction or if I was in a state of rest, there was always the same quality of light. Be like being at home and you're trying to relax and there's always just a glaring light on you. Or having the comfort of my wife present, who was also accompanying me when I was in a state of disorientation from pain, her being asked to leave the room because the room hadn't been designed to accommodate for even a little bit more space to have someone else present.
Hmm.
Um, Showing up in the hospital in a very, very elevated state of pain, which again had came with some disorientation, having nowhere in that triage space to lie down, just nowhere that could really accommodate or flexibly accommodate uh, my experience in some way. And you said to me something that I kind of the starting point for our conversation. You said to me that hospitals are engineered; they're not designed.
Hmm.
And I think that we could maybe extend, I'm sure we could probably apply that same logic to other aspects of healthcare, but in this context, we were talking about a hospital. Maybe let's start there. What did you mean when you said hospitals are engineered, they're not designed?
Well, the thing is, we are coming from a time where many advances in modern medicine have come out of the double-blind, peer-reviewed scientific approach that typically focuses on the parts rather than the whole. And that comes from an engineering mindset that um, historically, because of regulatory complexities, because of technical complexities, leans towards over-engineering the experience. Um, it's important to remember also that hospitals like have only recently, just from the turn of the 20th century, have been electrified, and so there's a every time a technology like is implemented across something. So think about electricity as something that has been patched on top of the hospital experience.
Hmm.
And so that there's an immediate excess of that thing in the experience, right? The novelty of electricity brought many advances to medicine, but it's as a direct consequence also like created a technical complexity that um, that was not designed to treat the holistic experience of a person, but rather that was applied to every area of healthcare separately. How might we give a doctor better, better sight of the operating table? How might we make, the hallways of the hospital, benefit from uh, uh, that vision being available everywhere? And so, of course, um, when we pair that with the fact that condition centric healthcare dehumanizes people, it's actually like very easy to see that no one really asked someone, hey, how do you feel in this room because of the lighting conditions? The assumption was that the doctor must see you wherever you are, even if it's the hallway, apparently. And what's important about this condition-centric design is that when I design for healthcare, it's so prevalent that I've actually had to give personhood to the conditions, the instruments, the hospital rooms, because they have such importance in the current experience that documenting how the frictions occur because of their importance, like they are active actors, becomes essential. And so like that's actually how blueprinting the healthcare experience like needs to reflect how mismatched the or how over engineered and under designed the experience is.